This chapter talks about the discussion section in a scientific article for health research. The discussion section is the final component of a scientific paper based on the format of IMRAD, Introduction, Methods, Results, and Discussion. And compared to the other sections, the discussion allows the most freedom in writing and structuring the text, making it both liberating and challenging to write. The objective of a discussion is to answer the research questions that were raised in the introduction by interpreting the findings. The discussion gives the authors the opportunity to explain the study findings and their implications to a broader audience. It's important to keep in mind that the introduction and the discussions should be connected. The questions posed in the introduction are addressed in the discussion, and the introduction must have introduced the key problems that are discussed in detail. The discussion section is where you get to address all of the components touched upon in the introduction, turn the data presented in the results section into knowledge, and provide a compelling argument on how the findings of the study contribute to existing knowledge. Keeping the connection between the introduction and the discussion sections in mind, the discussion follows an inverse funnel shape that gradually broadens, as opposed to the narrowing funnel shape that described the components of the introduction. The discussion starts narrow with the summary of the main findings that provide the answers to the specific research questions, followed by contextualizing the study findings within the existing literature by comparing them to previous studies. Then the clinical or public health relevance of study findings may be highlighted. The strengths and limitations of the study are discussed. And lastly, concluding with the future directions and implications. The summary of the main findings provides answers to the specific research question raised in the introduction. If there were many research questions, or if the question was very complex, you may briefly remind the readers what the research question was at a high level. The key findings for the main research question should be interpreted first, followed by findings from any secondary analyses. Furthermore, you should explicitly and concisely state the verdict on the research question when summarizing the main findings, as this is the key information that readers are looking for. Overreaching conclusions or overgeneralizations of study findings should be avoided, and the results should be interpreted based solely on the people who were included in the study sample. Next subsection in the discussion is contextualizing the study findings within the existing literature. The introduction presented background knowledge and set the tone for the rest of the manuscript. In the discussion, the results of the study are interpreted. So in this section, you're expanding the high-level information that was introduced earlier and contextualize the findings of the study within the literature. The study findings are compared to previous studies and placed in the wider context of the topic. By comparing the study findings to similar previous studies, you may discuss whether the study findings agreed with or were contradictory to previous studies. If the findings of the study were similar, you should explain why the new study was needed and how it contributes to the literature. If the findings were conflicting, you should explore the reasons for this discrepancy. While relating the study findings to other studies and placing the current study in the literature are important components of the discussion section, its main focus should be on how the analysis and findings of your study adds to the existing body of evidence. In the discussion section, the clinical or public health relevance of the study findings can also be highlighted. The main question you want to ask yourself is, who is your target audience? For a scientific article in population and public health research, the target audience may be clinicians, other researchers, patient communities, and members of the general public with an interest in the health topic. So it's critical to stress the relevance of the study findings to your target audience. Keep the specific target audience in mind when explaining why and how the study findings are meaningful. For example, if the study's goal was to evaluate the effectiveness of a drug in treating a particular condition, you may want to emphasize how the findings are important for patients or how they may affect clinical decisions for healthcare providers. In this subsection, the study's specific strengths and limitations are described. This is a particularly challenging and important section to write, as reviewers and readers will scrutinize this very closely. First, rather than providing generic limitations and strength, try to discuss the strength and limitations that are unique to your study. For example, for strength, you could discuss how the study has done something new, how it adds to current knowledge, or how it supplements, reinforces, or contradicts previous research. Similarly, for limitations, highlight what are the unique limitations to your study. This could be related to the data, design, or the methods used in the study, or unmeasured confounding specific to the study, assumptions that cannot be tested, and lost to follow-up or missing data. In addition, it's crucial to not only describe the limitations, but also the measures taken to mitigate them. The discussion section is where you can defend your work and show to readers and reviewers what steps you have taken to mitigate the limitations and to strengthen the robustness of the findings. So it can be good practice to approach this strength and limitations section as if it was a critical appraisal or a peer review. For example, you can ask yourself, what kinds of issues might the reviewers raise about the study? What are the potential biases? If you can anticipate these questions in advance, then you may be able to prepare the responses accordingly. In addition, when discussing potential sources of bias, you can discuss what is the direction and magnitude of the bias, as well as how this may affect the study findings, and what efforts were made to minimize the bias. Finally, when discussing the strengths and limitations, you should explain the robustness and the generalizability of the study findings, as well as the reproducibility of the study. Lastly, the discussion usually concludes with future directions and implications. Depending on the focus of the paper, the discussion section should describe some of the potential study implications for clinical practice and/or research. Based on the study findings, you may be able to suggest the next steps for future research in this area. You can make recommendations based on the remaining unanswered questions or unavailable variables, measures, or outcomes in the data. The description of future directions should be short and specific. In addition, it may be a good idea to conclude the paper with an overall big picture of the study. What is the take-home message now that you've presented the story of your study to the readers? Overall, the summary of the study implications should be clear and concise, written in a way that readers can easily grasp the key message of the study. As a recap, the purpose of the discussion section is to provide the readers with a summary of the main findings, and based on these, answer to the central research questions posed in the introduction section, and to contextualize the study findings by comparing them to previous work, to analyze the study's specific strengths and limitations, and through this process, expand on the study findings to provide the significance and implications of the study and offer future directions in a specific research area. The following are some additional do's and don'ts when writing the discussion section. First of all, do provide the answer to the research questions at the beginning of the discussion and ensure that your answer is in line with the research question presented in the introduction. Although it's okay to make speculations based on the research findings, do present these as speculations and not as causal inferences. If there was anything surprising about the findings, or if the results went against the initial hypothesis, do discuss what were these surprising or unexpected findings. And do present the key limitations clearly and discuss how they may have impacted the results. Finally, do criticize your own work and acknowledge their limitations transparently. However, make sure to use the discussion section as an opportunity to defend your work and to talk about the steps you have taken to mitigate some of the limitations. First of all, in the discussion, you do not need to present in detail all of the secondary or sensitivity analyses that you conducted. You can just discuss the analyses that contribute to the robustness of your interpretation of the findings. It's important that you do not omit any potential alternative explanations of the findings of your study. In the discussion section, Reviewers will mainly be focused on whether the interpretations and conclusions drawn were supported by the evidence presented and whether there were any alternative explanations that may be plausible. Do not restate the findings too repetitively. However, the paper should end with a clear summarizing statement of the manuscript's storyline. Last but not least, do not interpret the absence of statistical significance as the absence of association. The findings should not be interpreted solely based on the p-values of the statistical tests, and you should provide insight and explanation on this result.